That should be coming. Okay, perfect.
So I'll start sharing.
So, so yeah, look, a bit, thank you everyone for joining us, and thank you so much, Mish, for sharing all your amazing knowledge tonight. So I will let you go with your presentation.
Thank you. Well, thanks, Dr. Bean, for having us here and calling this meeting. It's really an honor for me, a pleasure to be here with you, presenting a few of the cases we've treated with cannabinoids here in Mexico. And we're steering completely away from dogs and cats, other than a couple of slides where I put information in for references. We're just gonna do things that aren't domestic species. So let me check that everything's working on my side. You can see my slides. Yes. Well, welcome. Welcome to our webinar, Cannabinoid Use in Avians, Exotics, and Wildlife in Mexico. It's going to be a brief overview of cannabinoid use as well as a few of the clinical cases we've seen here. And my name is Dr. Mish Castillo. I am a veterinarian and I have been certified in several cannabis certifications. So I'm the equivalent of what would be a doctor in veterinary medicine. I'm a médico veterinario zootecnista here in Mexico from the National University in Mexico. I have a diploma in domestic and wild feline medicine, also from a university here in one of the states in Mexico. And I started getting my certifications back in 2017 when cannabis was legalized here in Mexico. You can see a few of them here. And I'm also a member of several associations relating to cannabis use in animals. Red Cannabis Medicinal Veterinaria it's based in Colombia, but it has Latin American groups, and they also work with other continents, so Europe, Asia, and Oceania. I don't know, Oceania. I don't know how it's pronounced in English. Sorry, and a few other organizations such as Veterinary Cannabis Society, the Canadian Association of Veterinary Medicine, and a society here in Mexico that is focused on behavior, ethology, and animal welfare and well-being. My conflicts of interest are disclosed in this slide. I am the Direction of Education, R&D, and the veterinary area at Cannabis Institute, Instituto Cannabis ICANN. And then I am an advisor for boutique and drug compounding pharmacy, as well as medical marijuana 411 and education platform. We will hopefully very soon be launching a veterinary education course here in this platform, MM411. So they also work in Australia. So hopefully we'll be going in there soon. The target audience for this lecture are veterinarians with the license to prescribe medications to animals in the country you're practicing, as well as vet techs, nurses, and other veterinary professionals and veterinary students. And as a disclaimer, please do not take this as medical advice. It's not a substitute for a consultation for prescription. I am not endorsing any products in your country, and being able to make purchases of products that in your country doesn't necessarily make them legal. So please consult your local laws. I will be talking about our Mexican side. I have no idea what's happening in Australia. So maybe that's a future lecture for us to have. And I will start by going really fast these first slides because I want to get to the clinical cases. They're interspersed with some other information. So sorry if I'm really, really fast, but I have 45 slides to go through and I don't want to, take 3 hours of your time. So I will give this part really, really fast. We have a lot of words to describe the same plant. I have included here, they're in Spanish. Obviously, I can change the slide, but it's marijuana. We call it weed. We call it grass. We call it catnip. We call it Mary Jane. We have many words for it. And when I say catnip, and I'm not talking about Nepeta cataria, the real catnip for cats, but when it's used as slang for weed. So what I want you to take away from this little puzzle in this slide is that the plant is always going to be the same plant. There already have been genetic studies on it, and they are all the same species. They are Cannabis sativa. We have different subspecies, different cultivars, different, what do you call them? Cepas, I forgot the name in English, but basically, your bubble cushion, your Gorilla Glue, Pineapple Express, all strains, that's the name, strains. So you have all of this. This is marketing. Hemp is also cannabis. Marijuana is also cannabis. So whenever you're talking about this plant, please understand that no matter the words we're using, it's always the same plant. That the things that will change are the legality around certain contents, mostly THC. So let's talk about the molecules that the cannabis plant produces. The molecules that are really, really famous are THC because of its intoxicating effects. It gives us the narcotic effects, feeling drunk, feeling high, and humans have been using it for medical and non-medical purposes. We will call non-medical purposes adult uses. They can be any use that is not a medical use. The other molecule that's really famous is CBD. These two are the most produced molecules in the plant and the first to be isolated. Well, not really, there was another one in there, but the most prevalent in the plant and the most studied up to date. But we have several other groups of compounds that the plant produces, and we have many other cannabinoids. So in the cannabinoid group, which you see here represented with a few hexagons to the lower right of the hexagon image, these cannabinoids we have found, well, I haven't found anything. People have found up to 150 phytocannabinoids up to date, and we continue to discover more and more. So take into account that a plant will not only have two cannabinoids, it would probably have a few dozen, if not over 100. Then we have the group of compounds called terpenes, and these are, well, I forgot to tell you, cannabinoids are found first in the cannabis plant. That's why they're called cannabinoids, but they exist in other plants. The terpenes exist in all the plants and they give smell and taste to the plants. And that's why cannabis plants also have different smells and different tastes if we were to eat them. And these are given by terpenes, and terpenes also have beneficial effects, such as if you've heard lavender is, reduces anxiety, it's because it has linalool, and linalool helps reduce anxiety, provides certain analgesia, and even topically can provide like local anesthesia. So a plant can produce hundreds, if not thousands, of terpenes, and these will also be included in an extract made from the cannabis plant. And we have another important group, the flavonoids. These are usually related to the color of the plants, but also have beneficial effects. One of the famous ones is silymarin. We're using it when isolated to treat liver problems. But there are also hundreds of flavonoids in a single plant, including a cannabis plant. So when working with a full extract, like full spectrum or broad spectrum, taking directly from the plant and extracting without separating the molecules, you will probably be working with dozens, if not hundreds, of compounds in a single bottle. And this will give what is called entourage effect, which means these compounds will all work together in the patient, together between them and together with other medications you're giving to the patient to provide even more like synergistic effects. So be warned that when you use full extracts, full spectrums or broad spectrums, you're going to be giving a lot of molecules to the patient. Then we have the reason why these cannabis plant molecules work in our bodies. Yes, first the humans, we did try it on ourselves first. A lot of millennia ago, 5 or 6 millennia ago, there's already documented information. But this endocannabinoid system is not yet taught in veterinary schools because it was found very, very late last century. So in the 90s is when we find it is discovered, And there's a simple version that says, we have endocannabinoids, so we already produce cannabinoids within our bodies without being close to any cannabis plant. We already have receptors called cannabinoid receptors, and we have enzymes that produce and destroy these endocannabinoids once they're done their job. This endocannabinoid system exists in all vertebrates. We will be talking about that in a few slides. And why is the cannabis plant able to give us medical effects that are so varied, such as the ones you see listed here? It's because the endocannabinoid system's main purpose is to regain homeostasis. What is that? The internal balance in our bodies. So we want, whenever we have a pathological effect, we have lost this balance, and stimulating the endocannabinoid system will try to return us to our balance. And why do we have the plant in the middle? It's a zoom in into what is interesting for us physicians. We don't care about the plant per se, we care about the molecules that are produced in and kept in the resin of the cannabis flowers, also known as buds. And the central piece, colleagues, is the veterinary profession and adjacent veterinary professions. Here in Mexico, we just have the one, but I know there are vet techs, nurses, and several other professions in other countries. And we are the ones in charge of medical prescription of these pharmaceutical compounds, of the dosing and the administration. So the legal status here in Mexico is that in 2017, medical cannabis was legalized. We changed the schedule of THC and its isomers. They were completely forbidden in Schedule 1, and it was reclassified to Schedule 2 when it has more than 1% THC, which requires a special prescription that is closely monitored by the government. And when THC is below 1%, it just requires a simple prescription, not controlled. 2021, the regulations are published, fully legalizing medical and research uses. Only when I say medical uses, it's only medications. So I'm talking about pharmaceutical formulations. And this, fortunately for us here in Mexico, includes veterinarians, referring to the professions who can prescribe, veterinarians can prescribe. And in July, this is just, an extra tidbit of information. Our Supreme Court declared that prohibiting cannabis use was unconstitutional, but that law is still being discussed. This means that here in Mexico, we have, unfortunately, a lot of products that are not regulated but widely available. Only medications are legal by law. We don't have any drugs with official registrations or health licenses yet, the number they assign to a massively produced medication. We don't have those yet, but we do have drug compounding available, and it is a great option for cannabis patients, especially veterinary patients, because we are able to basically do whatever kind of formulation we think the patient will need. So low concentrations for very small patients and very high concentrations for bigger patients or patients with more severe ailments. Unfortunately, as I was telling you, there are no regulation for non-medication products, so supplements, nutraceutic beverages, um, treats, food, nothing in all these things is regulated here in Mexico by any agency, but they are widely sold. There are no advances on non-medical uses in the laws. There is a very high demand of products because it's a trend and because marketing has blown up. The market has been flooded by unregulated products. As you can see here by the blurred image, they have a huge array, and that's just one brand. We have hundreds of brands here in Mexico, and they are all supplements and not regulated. There is also a very significant lack of knowledge regarding the terms, the uses, the legality. People think that because you can purchase it, it is completely legal and it will cure you of whatever says on the label. Unfortunately, this puts human consumers and especially veterinary patients at risk, and we have had patients die. This is Sashi. She was living in one of the other states here in Mexico. It's called Tlaxcala, and the pet parent decided to help Sashi with a supplement that he bought but wherever, started giving it to her. She started presenting neurological signs and unfortunately passed away, even though we remotely suggested hospitalization, ceasing of the product. She continued presenting signs and unfortunately passed away. What are we thinking? That this product was contaminated with pesticides because the neurological signs she was presenting could have been from THC, but they kept presenting despite not giving it anymore. So we're thinking neurological effects from pesticides. So we have some statistics. Is Mexico the third country to fully legalize cannabis? This seemed to be the conversation about 3 or 4 years ago. The truth is, it's not. The full legalization hasn't happened yet. The only fully legalized is medical. And here we have the other two countries that had already legalized all the uses. Uruguay with 3.4 million inhabitants, Canada with 37.5 million inhabitants. These are numbers back from 2022, and Mexico with 126 million inhabitants. So you can see why the market is interested in Mexico. We are huge. There is an estimated 80 million pets in Mexico. I know we're not only going to talk about pets or companion animals, but it is important to point out that we don't really have statistics of how many zoos there are in Mexico and how many animals each of the zoos have. And we have zoos, we have parks, we have reserves, so we don't have very clear statistics on all of these. But we do have pet statistics, 80 million pets in Mexico as a country. Out of those, um, sorry, it appeared kind of weird. We have 48,000 veterinary professionals in Mexico, which is very little if you take into account we have 80 million pets. And Mexico City alone has about 27 million inhabitants, and that makes difficult estimates, but between 23 and 28 million pets in Mexico City. And about 85 to 90% of those are dogs, if you can see the image here on the right. The blue are the total number of pets. The yellow are the dogs with 43.8 million. Cats are recorded at 16.2 million. And uh, birds and fish are about 20 million. And this kind of makes sense when you see the avian patients we've had. They very quickly surpassed the number of cat patients we've had. And here we have the information of, the 48,000 veterinarians. I'm not gonna delve a lot into that. By the way, if you want my slides, I will gladly share them with you. Just hit me up in the end of the slides. You'll see my WhatsApp and my email, and I can gladly share them with you. Or I can share them with Dr. Bean, and she can share them with you. So um, I've already said a couple of these points. We at Icon Vets, the veterinary area at Cannabis Institute, we started working with pets, dogs specifically, in 2020 first quarter. And then that same year, 2020 fourth quarter, we started working with wildlife with our very first patient, who was an elephant. Why did we start working with wildlife so soon, not even a year after starting working with dogs? Basically, because all the information available in journals pointed towards what I've already said. All animals, well, almost all animals have an endocannabinoid system, and all vertebrates have an endocannabinoid system. And here we see an article by Dr. Silver that talks a little bit about that. Whenever you see a QR code and an article in one of my slides, the QR code will take you to the article, but I can also share it with you upon request. So basically, we know that it exists in all animals, and that if you start a very low dose, it's unlikely that you will cause any adverse side effects. So that's basically why we started working with wildlife. Each patient, well, this one appeared in Spanish. Let me there. Each patient is different and will respond to a different dose than other patients. Do not extrapolate information from one dog to another because they will respond different. And so we started working with drug compounding from early 2020. We wanted to do research from 2019 when we already had imported CBD isolate to Mexico, but it's really expensive. No one was sure that they wanted to work with it, so it was a more viable model to start working with patients one on one and start getting our clinical cases out rather than go preclinical or clinical research right away. And we started working with drug compounding because, as you can see, we can do all sorts of concentrations. Our lowest drug compounding goes to 0.5 mg per milliliter in oil. And we have here you can see the 200 mg per milliliter max, but we have been able to go up to 250 with CBD isolate, up to 300 when combining CBD isolate and CBG isolate. So that's why we started working with wildlife. We figured we would start a very low dose with these patients, increase slowly, be wary of any adverse side effects, and stop if any of them presented. Administration. I will show you the administration routes we use for all of our patients in order of more common to the left to less common to the right. The most common is oral administration. Yes, you will see dogs and cats in this slide. I didn't have a lot of animals getting dosed for this slide, but so I kept dogs and cats. We do not recommend giving it directly from the dropper. It's not an adequate way of administering because more drops will be delivered than the veterinarian recommended. We will also have little cat, dog, or any other animal drool on the, well, saliva on the dropper, and that will probably just go back straight into the bottle, and we get cross contamination. So, what we do recommend for dosing orally is applying or putting the oil on treats or not on the entire dish of food the animal will consume because not all of them will eat their whole ration at one time. So treats are better. Anything the animal likes that is not counterindicated for their diet, you can, especially if it's a little bit like a cookie, it's a little bit of absorbent for rabbits. Things like compressed alfalfa treats work great because you can put it there. We will talk about rabbits further down the line, don't worry. You put it there, the oil gets absorbed, and then you give it to the patient. The patient says, "Oh, a treat," and they eat it really happily. And it's very important that you do follow up with some other food afterwards, so not only the treat. It's not ideal to give it on an absolutely empty stomach and just give the treat with the dosing because it will not be absorbed as quickly. When you give it before the meal that the patient will have, they will eat the treat with the CBD, then you give them their ration for that time or for the day, and they will process the CBD more, well, faster. For certain felines, the liquid tube food works great, but again, it depends on what species you're treating, what the animal likes as a treat, and what you can give to them. The transmucosal administration for humans is called sublingual. Animals will not keep it under the tongue for a minute, then, let it absorb and then swallow it. It will almost always end up being an oral administration by the end. It will start being absorbed in the mucosa and then it will be swallowed. We have buccal, like oral in the mouth, transmucosal administration, but it can also be delivered into the nose and it can also be delivered rectally. When do you use this for patients? You only used it in a very few cases, mostly when the animals are very anxious, dogs and cats, and they will not take anything like orally. You can put it in the mouth and it will be absorbed. A few horses also work to put it in the mouth. They have a lot of space, in between their cheeks and their lips, so smaller amounts of oil can be deposited there. And nasal works when they have respiratory infections in the nose, specifically, multiple antibiotic resistances and such. And the rectal, I've only heard about it for patients who have epilepsy. They have an active crisis. The mouth is, chewing or doing motions that unable to give it through the mouth, so you could go in through the rectum. I've also heard about it being used in the Cali Zoo in Colombia because the mouth is busy with something else, because the animal is under anesthesia and receiving several other treatments at the same time. So cannabinoids going rectally, no publications about it. So, it works, but there's no scientific research to support it. The topical will not be absorbed systemically. It will only work as long as it is applied on the patient's wound. So be sure to clean the area, remove any fur if possible, and apply it, try to cover it with something so it stays there. And by inhalation, I do not mean smoking or vaping or any sort of thing that involves like the full plant and smoke or um, harmful vapors. What we recommend is nebulizations with water vapor. So, like asthma micronebulizers work great. That puppy is a stock image. A lot of animals will not allow to be, well, they will not bear the mask, and they will not allow the motor to be so close to them because it's very noisy. I'll show a slow video in 1 second. And these two are our most suggested frequency of administration. So for animals that eat twice a day or can be handled twice a day, twice a day is ideal for most cases. A few of them, mostly zoo animals, only get handled or fed once a day, so we include it in the once a day dosages. But some other patients, especially the very painful ones, these are mostly dogs and cats, the most painful or epileptic patients may require administration every 8 hours, every 6 hours, or even every 4 hours. Both dogs and cats have a mean plasma concentration peak time of, I think that's the name in English, of about 4 hours, 4 hours and a half. So they might need redosing. We do not have PK or pharmacokinetic or pharmacodynamic information on plenty other species, so we have no idea. Try to dose them at least once a day, at most twice daily, until you see results, and then you can change to a higher frequency if needed. This is Simon. This is how we can nebulize a patient. I will turn down the volume. He has asthma. He's a cat. His pet parent is a behaviorist, and she has trained him that that box has his towels, has the diffuser in the back that you could see, and he gets diffused. Yeah, well, they put the lid on. It's not hermetic. He doesn't suffocate in there, but he gets his vapors in there, and he gets to inhale water vapor carrying CBD, sometimes CBG, and sometimes terpenes as well. So this is what we would recommend for inhalation. If you have a metabolic chamber, you can attach the nebulizer to it. We will see a video further down the line. But if not, or for home treatments, something like this works. Or, their regular cage where they get transported like to the vet or wherever, you can cover that with a small towel, put in a nebulizer or a diffuser, and you can nebulize the patient there. Time to start seeing effects, onsets. When you give it orally together with food, after at least 4 hours of not eating anything else, the patient will start showing signs of the onset of the CBD in particular, about 40 to 60 minutes after being dosed. A few of them start before, a few of them start later. I've had a dog who took 6 hours before he started metabolizing it. He was really skinny, he was really old, he had a lot of problems, including liver problems. So, yes, this can vary patient to patient. Oh, sorry, I clicked the wrong one. Transmucosal can start working in within 2 to 15 minutes. It depends on how much is actually touching the mucosa, how much was not swallowed, and the volume that we administered. Obviously, administering a small volume with a high concentration will have a better result than a higher volume with a lower concentration, not slower, lower. Topicals have no systemic absorption, and inhalation will take 5 to 20 minutes depending on what the dose and the method of administration. So a patient that will accept the mask and is breathing the vapor directly will show effects faster than an animal like Simon, who is in a bigger box with a diffuser, which is not a nebulizer, that produces a lower volume of vapor, and the particles are slightly bigger, so not as much will be absorbed. And here in red, we see not oils. We are not nebulizing oils. We have to nebulize water-soluble formulas. So hydrosoluble, the ones that are already based in water, or what we're working here, we'll see further ahead, are alcohol-based formulas. We use very low volumes, so there will not be any irritation to the patient's respiratory system. So I'll advance this slide for a little bit and let you read while I take a little sip of water. I usually do these animated slides because I like telling you step by step, but sometimes I take too long with the slides. So there will be pharmacological interactions. This is a pharmaceutical active principle, so please do not believe that it's not going to cause any harm or not. There's not going to be any side effects. There can be. But if you're smart about the dose and start at a low dose and seek for a minimal effective dose, you should not see any side effects. Why can we see side effects? Because it's metabolized in the liver in the cytochrome P450, and it may or will slow metabolism of other drugs that are metabolized in that same cytochrome. There are special considerations for special populations. There's a question whether patients will create tolerance or resistance. What do I mean about with this? That I start giving a same dose and will not see the proper beneficial effects anymore, which will need me to increase the dose to see these beneficial effects. This has only been reported with THC in humans. And honestly, humans take doses specifically in THC that are way too high in comparison to what we use in our veterinary patients. So it is not reported in animals. Whenever it's been reported to me in an animal, it's always related to non-regulated products, so artisanal or supplements, non-regulated. They can contain different varieties of plant or extract batch to batch, and it's always related to the change of a bottle. My bottle ran out, I bought another one, and they needed a higher dose of the different bottle, so they created a tolerance. No, sir, no, ma'am. What happened there is the formulation was different and the patient responded different to the different formulation. This does not happen with drug compounding and would not happen with registered drugs because they always have the same concentration of active pharmaceutical ingredients. There are refractory patients. What does this mean? That we may give doses that are way higher than what we usually give our veterinary patients. I'm speaking mostly dogs and cats. We have encountered a single refractory patient in the time we've worked, which is about, 5 years working with Bodycon. It happens. This patient went up to about 8 mg per kg, no response whatsoever. He had atopic dermatitis. There are published studies that say CBD helps with atopic dermatitis. This patient does not respond. So there is a possibility of refractory patients when you increase the dose several times and reach higher doses and see no response. It's not the patient's not a candidate for continuing cannabinoid treatment. Pregnant and lactating females. There are no safety studies in any species other than humans. Cannabinoids will be excreted in milk, so be cautious. It can be used in these patients as well as their offspring, so cubs and all the other names for the offspring of our animals. They might be there if you dose the mother, the cubs will be exposed. So just, you have to do an examination of risk and benefit for that specific case. It can be used. I've seen it used in several patients, but we have no studies, so be careful about that. Elderly patients, they will metabolize different. I was just telling you about the patient who just took 6 hours to metabolize. So he had trouble sleeping. We had to dose him about 2 p.m. in the afternoon. So he would start getting sleepy about 8 p.m. in the afternoon and sleep through the night. It does happen. And elderly patients usually have comorbidities, several illnesses. So take that into account. Multi-drug patients, patients that are taking three or more drugs will also have interactions. So we have to take special care with these patients. And patients with heart pathologies, because CBD and other cannabinoids can cause a decrease in blood pressure. It's usually transient and it's usually just at very close to the time of dosing. But if you have a patient that has a heart pathology, you do not want to compromise the heart any further. So it is ideal to monitor them closely and dose them with lower doses that you would do other patients. Same with liver pathologies. We are not harming the liver, but it will start working a little bit more because of liver metabolism. But cannabinoids, including CBD, are liver and heart and kidney protectants, so they can be used. Just be careful about dosing. And what we want to do is what you see here. We want to start on the green line very low, very slow, and start increasing gradually to find the ideal dose for that patient without reaching the red line, which would be side effects. There's also something called the biphasic effect, which means that at a certain dose there will be no response. At an other dose, completely depending on each patient, we will find an optimal dose, and we're used to straight lines. We're usually used to, like my head hurts a little, I take an aspirin. My head hurts a lot, I take two aspirin. My head hurts really, really a lot, I take three aspirin. And we would go on a straight line up. That does not happen with cannabis. If we increase the dose, a lot of patients will stop showing beneficial effects and will start showing adverse effects. And the entourage effect we covered earlier. So just remember, if you're using full spectrum, broad spectrum, there will be hundreds of compounds in that, and it will interact with other things you're giving your patient. A question we often have is whether a patient is or will be drugged or high if we use cannabinoids with them. And then again, we are not talking about a patient that is smoking a joint or that is smoking a shisha. We do not want to see these kinds of signs in our patients. This means the patient has been intoxicated or has been overdosed. We don't like, personally, I don't like neither of these words because it's not a toxin, but it will cause side effects. And overdosing is usually in our minds, in the general population's minds, is usually related to they died from an overdose, which means cardiac arrest, respiratory arrest, and the patient will die. This will not happen with cannabinoids. Cannabinoids do not have a lethal dose that has been encountered thus far. This means that their heart will not stop, they will not stop breathing, they will not die from the cannabis dosing. But if they're having a convulsion, they throw up and they inhale their vomit, of course they are at risk of dying, secondary to inhaling a vomit and getting, pneumonia. So that can happen, be aware, but it's not a death directly caused by animals. The first report of intoxication we ever found in a cat was the one you see in the right, 2018. And this was basically caused by secondhand smoke. So whenever our pet parents, our clients, our consumers, please let them know not to share the smoke with their animals because there could be adverse side effects. In this cat, it was mostly behavioral. He became aggressive. He became, unruly, and ended up in the hospital 2 times until the pet parents said, yes, we do smoke cannabis at home, and they found THC in the cat's blood. We also have a report of toxicosis in two donkeys. For some reason, people fed cannabis buds to two donkeys, a male and a female, and they presented several adverse effects, again, from ingesting this, and they also found THC in their blood serum. So please do not give plant cannabis plant or buds or extracts to donkeys just for the sake of it. We will talk a little bit more about rabbits in a few slides, but it's important that you know that there's also a report of cannabis toxicity. Same thing, the rabbit was behaving erratically. He presented a convulsion. He was lethargic, not quite responsive. And he spent the night in the hospital, and the next morning the pet parents came home and said, I think he might have eaten my cannabis buds. So yes, the rabbit ingested this and presented adverse effects. And poor rabbit was only 3 months old. And there's also reports on iguanas, three iguanas that have taken cannabis, different presentations, and again, they presented with seizures, with digestive and neurological signs. So, again, do not dose these patients if it's not veterinary indicated. Sorry, it's kind of late, and the cold messes with my nose. So, is there a risk of addiction? It's also a very frequent question. The risk exists, again, reported in humans, reported for THC. Remember, humans really enjoy THC, or, well, it feels good. If it feels good, we want more of it. It's not a physiological dependence, but there is a risk in humans. However, it is similar to caffeine, which means it's lower than nicotine from tobacco or synthetic nicotine or alcohol, and it has not been reported in animals. Here are some of the side effects reported in dogs and cats with THC and CBD. I will not stay too long on this slide because, again, I have 30 more slides to go. So I want to go through them a little bit quicker. But as you can see, they can present digestive symptoms, neurological symptoms, and behavioral symptoms are the most seen in them. They will vary from patient to patient, and they will vary by species. So please do not think these are like the specific signs. It will be definitely different in every case. And when we're talking about other species like exotics and wildlife and avians, they will be different from what is reported from dogs and cats. So I've been speaking for a while now, and I haven't really mentioned, other than the refractory patient, a lot about dosages. Here's the meme in Spanish. What is the dose? Because that's what everyone wants to know. Because we're very used to the pharma industry putting the indications on the box. For dogs, use however many mg per kg or milliliters per kg, blah, blah, blah. We do not have that in cannabis. I do not have time to explain this fully in this session because it's not about that. I hope that we may do other webinars in the future talking about this a little bit more. But again, I will insist there are no standard dosages with cannabis. Each patient will respond to different doses, even if they're siblings from the same litter and they have the same illness, let's say distemper. They will present different signs and they will respond to different dosages. So let's start talking a little bit about the earliest clinical research on dogs published in journals. We will see dogs were the first species with clinical studies published, and you can see that four different studies. There's five on the right, but the ones in red are either on this table or below in the safety ranges that we'll see next. And here I've done in a little ruler with colors, like the ranges of dosages we work with here in Mexico. We worked with micro dosing, which is under 1 mg per kg. Low doses go from 1 to 2.5 mg per kg. 2.5 up to 5 we consider a medium dose. Over 5 up to 7.5 we call a high dose. And anything over 7.5 we call a higher dose. We rarely go up to these dosages, but you can see the earliest publications would go anywhere from 0.25 mg per kg up to 8 mg per kg. And when they started doing safety ranges, they went kind of crazy. So I have to make my ruler a lot longer so we can include up to, I believe we go almost up to 60 mg per kg in this ruler. And the safety ranges that from the authors marked in red up above, you can see that cats have been tested up to 30 mg 30 above 30 mg per kg CBD and above 40 mg per kg THC. We can see them appearing in our screen now, and those have gone up to almost 65 mg per kg, and my ruler isn't enough to go well, I said them in the wrong order. THC over 50 mg per kg, and CBD goes out of my ruler 65 mg per kg approximately. But guess what? This is again dosages published in journals, and something I keep telling people who want to use CBD or other cannabinoids in their clinical practice is real life patients are not clinical study patients or journal publications. What we have seen with our 5 years working CBD and CBG in patients is that dogs, cats, and avians, specifically citizens, so all of the parakeets, parrots, um, cockatoos, cockatiels, all these, beak with a hook birds respond under 3.5 mg per kg about 97% of the time, and wildlife and exotics go even below that. So we're talking under 1.5 mg per kg for all of the other animals, and we'll see that in more depth in a couple of slides. So I've been talking a lot about dogs and cats because that's where there's a little bit more published information and we have a lot more patients that are dogs and cats. But what about other species? How did we start? How did we decide to work on an elephant? They basically came to us and said, these elephants aren't getting better. How can we help them? We've treated, all these other treatments and they're not really working. We were hesitant at first, I yes will admit, but we started first searching for references. It's very important that you do seek for journals and literature about if whether cannabinoids have ever been used on them. Most of them will not have cannabinoid history. Then we have to go research their metabolism. And here you can see an article talking about cytochrome P450 in elephants, and well, this one is about rhinoceros, and you can see this highlighted part says that blah 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 sequences showed that the rhino, unlike the rhino, the elephant's cytochrome gene sequences seem to be more closely related to the mouse than to the white rhinoceros. And most elephants, for some reason, are those like horses. So if we had dosed our elephant like a horse, we would have gone up to 500 milligrams total and even 1,000 milligrams total. However, we decided to start with a much lower dose because we were worried there might be side effects. No other published studies were happening with the elephant. So we started at 0.01 mg per kg. Do not start with 2 mg per kg. Do not start with 8 mg per kg. Do not start with 80 mg per kg. By the way, there's a study that gave cats 80 mg per kg THC. So again, they will not die, but there will be side effects, and we do not want to do this in animals that are kept under human care that are highly valued, because maybe a zoo only has the one elephant. This one had more. But then again, we do not ever want to put any animals in harm or in risk. Start very low. Whenever available, particularly if you have drug compounding, use isolates, use few molecules if you don't have any other studies. Why? Because there will be a lower risk if you only give one hexagon from the image I showed you about the molecules than if you give hundreds. If you give hundreds, and the animal presents side effects, you will not know what the side effect is from. If you give an isolate and there's a side effect, you know it's from that isolate. If you give two molecules, you will know it's from one of those two molecules. So here are the doses. We started with our elephant patients. This is Dr. Quetzali Hernandez, the main veterinarian in the elephant case. And this is, we call her Nidia. Her name has been changed to conserve her anonymity because the zoo asked not to be named and not to name the elephant. But here we see her. We did publish her case in Spanish, and she is trained for protected handling. She is trained to open her mouth. That 1 milliliter there contains 225 mg of CBD G total, CBD total, and that's her full dose, her final dose, which is 0.05 mg per kg. We started seeing a response from the third dose from 0.0375 mg per kg. So what are the final doses we've seen in some of our wildlife patients and exotics? Please, as I said, do not believe the box and what it says. The dose is never 2 mg per kg. You always start low, go slow, stay low. So using body and drug compounding, the final dose for the elephant was 0.05 mg per kg with a starting dose of 0.01 mg per kg. What was the final dose for our green macaw, our very first avian patient? He went up to 3 mg per kg, but it took us 3 months to reach that dose. We'll talk about it a little bit. He has his own slides, so we'll talk about that there. But it's important to highlight that um, citizens do not have CB2 receptors. So CBD usually binds to CB2 receptor. Why is it working? We'll see it in a few slides, but that's why he went up to 3 mg per kg, much higher than dogs and cats, which usually stay under 2 mg per kg, or even in microdose under 1 mg per kg. What have we seen in our collaboration with Dr. Mary Wong in her exotic animal hospital, Pet Exotical? We have seen that all of her exotic patients respond in the range of microdoses, which means under 1 mg per kg. She usually starts at 0.1 mg per kg or 0.25 and does 0.25 increases, so 0.25, 0.5, 0.75, or the highest 1 mg per kg. No patients in her hospital have ever gone over 1 mg per kg. And here's a study by Divin et al. That came out. Well, we started treating our macaw in 2021. And if you can see this study, it's published in 2022. Well, the preprint was the one that appears on top is the preprint, and the one that appears in the bottom is the final publications. And here you can see that it says that they searched the genome database and found a complete absence of functional CNR2, that's cannabinoid receptor 2, in all parrot species investigated. And it does not happen in other species that are closely related to parrots, like falcons, serenas, and passerines. And in the bottom, you can see the same thing. We consider this conclusive support for the complete absence of cannabinoid 2 receptor gene in parrots. So parrots do not have CB2, and that's the reason we had to go so much higher with our parrot patient, well, macaw, when we started dosing him in 2021, where there were no publications available in avian dosing for citizens. There can be side effects in some cases. The two cases that you will see, the dog and the cat, were not treated by us originally. They were treated by a supplement, and when side effects appeared, they consulted us as Cannabis Institute to see what we could do to help. And here you can see a patient, a Chihuahua patient, about 4 kilograms, who had been dosed with 1 drop of a full spectrum, about 0.5 mg if the label is right in there in what they contain. They're usually not. And you can see she's trembling. I don't know if you could see her muscle at the beginning. You can see her ears. She has tremors, like her body tenses up and she shivers a little bit. She has hyperacusia, which means she's very sensitive to sounds and she startles easily. She also has photosensitivity and her eyes are inflamed and reddened. This is also secondary to THC. She basically started presenting ataxia, then went on to increasing severe side effects, including urinary incontinence, fecal incontinence, all happening within her little bed. She had hypothermia, but then she had hyperthermia. She did throw up, and she also presented at least one convulsive crisis reported by the tutor. This video is taken 14 hours after administration, and you can still see side effects. This is a cat with an unknown dose, also dropper to mouth, so we don't know how much was given, of hemp oil, so no THC. This one at least did have a certificate. Again, we don't know if it was real, but it seemed to be real. And cats present something that no other species do, which is called involuntary head movements. And you can see in the video how this cat, who we will call Michi to preserve his anonymity, his head goes up and down very slowly. It doesn't get any worse than this, but it starts presenting about 5 to 20 minutes after oral administration and can last up to 60 or 90 minutes. Nothing else happens with the patient, but then again, the pet parents do not like seeing this. It's very like, what's happening with my cat? In the case of citizens, we have also seen very different responses to doses in animals in the same family, again, Cetaceae. This patient had severe plucking, as you can see from her chest, and she ended up taking up to 20 times the recommended dose, showing no effects whatsoever, no beneficial effects, and no side effect, no adverse side effects. She went up to 40 mg per kg. We usually recommend up to 2 mg per kg in citizens. She went up to 20 times the dose, no adverse effects whatsoever. Meanwhile, this poor cockatoo, she ended up by an error in communication and in understanding with some telemedicine issues. And, you know, I said something to the veterinarian said it to the pet parent, and the pet parent somehow got lost in translation, I guess. And she received 10 times the recommended dose. I don't know if you can see how her eyes are also looking puffy. Her face is reddened and her legs are also red. Here's an image a little bit closer. You can see how skin that should be pale is actually inflamed and reddened. And what happened here in the lost in translation is that she was prescribed 0.06 ml milliliters in a very small insulin syringe without a needle or tuberculin, depending on, 100 units or 1 milliliter. And the pet tutor understood that she was supposed to give zero point 0.6. She missed a zero and gave 10 times the dose. So we did see these adverse side effects, and I'm happy to at least have some evidence to show you, because we've only had 3 patients in over 200 avian patients that have presented side effects. One of these was this patient. Her name is Millie. The green one, I forgot her species, sorry, is named Saki. Well, Suki. And Millie did present this. It resolved on its own about 6 to 8 hours after administration, and we stopped CBD for a few days before restarting it, not at zero point 0.6, not at 0.06, but at 0.02. So the very first line in this syringe. The other two avian patients just presented with grumpiness, with excessive vocalizations, and with avoidance of the pet parents. So I feel ill, leave me alone. It's very significant to pay attention to behavioral changes, because that's one of the very first signs in a lot of our patients. I gotta go quicker or we're gonna be here for long. This is Nidia, or Asian elephant. You can find our preprint case here in the QR code. And as I said, this is the case of Dr. Quetzali Hernandez Nava. The patient was over 45 years old. Her exact age was unknown because uh, she was first in a circus, and then she had been in a different zoo, and then she was decommissioned, like taken from that place because she didn't have papers, and taken to this other park. And this park had had her for at least 7 years. She always had problems with abscesses in her forelimbs, and they had always been resistant to treatment. So a lot of treatments have been implemented. It's nothing against the park. Elephants are used to walking long distances, and when we keep them under human care, our enclosures aren't big enough for them, and some of them get predisposed to these abscesses. So as I had showed you, she was trained for protected contact. You saw the video of her receiving the 1 milliliter with 225 milligrams CBD. And after the oil was deposited in the back of her tongue, she received fruit, so she would eat it as a treat. So that's ideally how we want to dose. She had a really low body score of 2.5 out of 5 and weighed about 4.6 tons in September 2020. we decided to go with the dosage calculated for horses, but for tiny horses. So we were aiming for 250. Back in then, we didn't have enough purity of CBD to go to 250 mg per milliliter. So we went to 225, and she received it once a day. In the scheme of we increased once a day, 0.01 the first day, 0.03 the second day, 0.04 the fourth day, and 0.05 the fifth day. And you can see her formula here. And this is the image of our preprint study. We did get her published in a scientific magazine, veterinary magazine here in Mexico, but it's in Spanish. I can also share it with you if you want. She was under treatment with CBD for 8 weeks. There was a 5-day suspension due to her first bottle ran out. It was the pandemic. We sent her second bottle, but it got delayed in the what do you call it? Well, the FedEx or whatever, guys. And the pandemic also made us lose some urine and blood samples we had because they were unable to go pick them up in time to take them to the lab. So unfortunately, we didn't have as much information for this case as we would have wanted. The first results were observed with the 0.03 dosage. She increased appetite. She was very selective about her food, and she rarely ate her hay. She just wanted the fruit and the yummy things. And she started eating better from day 3 and started gaining weight right after. And her abscesses were about the size of the red circle when we started in October 2020. And by December, you can see they are as small as the green circles. They are no longer active. They're starting to close, and they close. We try to close them from the inside out, so we have to keep that opening open so it can keep draining and healing. And you can see here at 7 weeks how these same abscesses have changed a lot. This one is pretty much closed, and this one's just a little dimple in there. Unfortunately, due to changes in the zoo, it was the pandemic. They started cutting personnel. A lot of ugly things happened. The treatment was suspended, and once the CBD was suspended, almost immediately within the first 3 to 5 days after suspension, her appetite decreased. She started eating less, and she started losing weight. Again, she started moving less, and again, she started feeling bad and being in a bad mood. Because can you imagine if you have these abscesses in your feet? I would also be in a bad mood all the time. So by now, she's already passed away, but at least we got to help her for a little bit with her abscesses. This is the second avian case we treated. And why do I start with the second? Because it's very easy to see the improvement in the pictures. The blank place will be filled in by a picture really soon. He is Charlie. He was treated by the primary physicians, Dr. Angeles Alvarez and Dr. Francisco Gomora. And you can see he presented seasonal psychogenic feather plucking. So whenever it was like spring and summer reproductive area, all the avians started screaming. He used to get really stressed, and he would pluck his feathers out. You can see how he was before treatment. Here's after a few weeks of treatment, you can start seeing the plumage grow back. And here is after a few more weeks treatment. I think it was in total about 3 months. He continued treatment for a little bit longer, but you can clearly see the difference of how he did allow his plumage to grow back. We used a 25 milligrams milliliter formulation because we like to use really low volumes to give them to them. He did stop plucking his feathers, they grew back, and his mood was improved. So he's a candidate for whenever it's about to start to give CBD preventative and as a treatment while it's happening. And once the reproductive season is over, we can stop the treatment and the patient will not go back to the behavior. However, we have this more complicated case, our very first avian patient, as I was telling you, a green macaw, Ara militaris mexicanus, and this was also treated by the same physicians, Dr. Gomora and Dr. Angeles. He also had psychogenic feather plucking. He was very anxious, nervous, skittish, aggressive, and screamed a lot. He was very vocal about things. He was always screeching. He had already had ruled out organic origins, so there were no parasites, no fungi, nothing in the skin, not a nutritional problem, no organic problems from the inside. He was healthy, but he continued to feather pluck himself and his mate and his children. He had had two, what do you call them in English? Well, two baby birds. Uh, in May of 2021, and they contacted us in September 2021 because you can see the one with the arrow is scalping. He's completely bare in his abdominal and chest area, and the other animals around him, as are his family, he's also feather plucking them. So he had been treated with drugs previously, not successfully. The environmental enrichment and training had worked, but not enough to make him stop. We started him on CBD isolate as well, very low dose, 0.25 mg per kg, and with weekly increases of 0.21. That's why it took us 3 months to reach the 3 mg per kg. Again, start low, go slow, stay low, and he ended up with a higher dose than most of the dogs and cats we had treated thus far. He was dosed on tapinas, so you can see his drug compounded drug here. Well, it does have a needle, but we did not use the needle. They, dose it onto here and then put it on the peanut, not on the shell of the peanut, but Dr. Gomora took off a little piece of the shell and deposited the oil on the peanut itself, and they gave it to the patient. We have a video here. So they started first week on CBD, 24 September 2021. And here's his training. He comes onto the little stick and he receives his peanut, and then he will eat his peanut. He will shell it and eat the peanut inside. Some of the CBD will be lost, it will get stuck to the shell, but that's why we like drug compounding and low volumes, because he was dosed 0.02 milliliters. So, again, the very first line in an insulin syringe, and that is more likely to stay on the peanut rather than go messing it everywhere. Many formulations in the US are so low concentration that you would need to use half a milliliter or a full milliliter. Of course, that's not viable to put on a peanut, just, drip everywhere. Here you can see him playing with some of his enrichments, but if they don't have CB2 receptors, how is CBD working? Here we can see him on week 3 of his treatment. His final dose, as I've said, was 3 milligrams per kg. We will see this little ruler and the arrow in several of the cases. And you can see here, he's, well, eating his peanut, but he's also starting to allow some of the more ventral feathers to grow in. There was a follow-up in May 24, 2022, so about 9 months after treatment, ongoing treatment all this time. But unfortunately, due to personal changes, like people were hired and moved into other areas, the treatment with CBD was suspended, as well as the behavioral treatment. When they suspended behavioral treatment and kept giving CBD, there was a slight regression, so behavioral treatment is needed. And when CBD was stopped, all progress was halted and the progress uh, disappeared. Why did CBD work? We have here a diagram, sorry that it's in Spanish. You can see the article in English in the QR code there, just showing CBD and its mechanisms of action in anxiety pathways. So stimulating anxiety or decreasing anxiety, and you can see all of the arrows are mechanisms of action. CBD is a very promiscuous molecule. It gets together with over 60 different receptors. So even if we don't have CB2, which would be here in the upper left corner, we have all of the other pathways that can work with CBD. So we did see the patient improve with CBD and behavioral. And if you add terpenes like the ones that just appeared, like linalool or pinene, you can also affect some of the other anxiety pathways. So here we have, again, we are trying to get him published in a Spanish journal, well, Spanish language journal, a Mexican one, but we also have a preprint available in the QR code. And here in the pictures, you can see how he was completely beginning of the treatment. Then he started allowing some of the smaller feathers, and in the chest you can see they're called phyloplumes, I think in English. Um, I think the word is covered in the image, and you can see how his skin was inflamed and irritated at the beginning, well, before treatment, and during the treatment, this irritation, inflammation disappeared. So the patient's skin was healthier. He did not get to grow his plumage back because he had been plucking for over a decade. So it was so chronic that the feathers did not grow back. Thus far, we've treated over 200 cases in avians. In these 4 years, we've been working with avians. Many of them have come from many of the wildlife, our collaboration with Dr. Gomora, who continued his work in that zoo and in another zoo as well. And the others have come with collaborations with veterinarian specialists, avian veterinarian specialists here in Mexico. It's an association. The logo is on the screen. We have treated over 50 well, here you can see the total of patients we have treated, but in species there have been over 40 different avian species we've treated. Most of them respond in microdose and low ranges. You can see 89 have been companion animals, so animals kept as pets, and 11% have been wildlife, which I mean they're either free living who get injured, rehabilitated at the zoo, and then released again, or animals that are kept in the zoo. And most of them, 81%, are citizens, the others are other species. Most have responded between zero point 0.5 and 2 mg per kg. We have Dr. Sebastian Andrade here. He's part of the Aves Association, and he and his team have worked with over 70 patients thus far, providing a significant percentage of the cases we're talking about here. All the wildlife avians allowed better handling when they were being dosed with CBD, including wild raptors, so they would be less skittish, less anxious, less nervous when being treated, because then again, as I've told you, they sometimes get injured in outside of the zoo. They get back to the zoo to be rehabilitated, and they have had several ailments ranging from feather plucking, infections of all sorts, malnourishment, fractures, pododermatitis, trauma, cloacal prolapse. A few have had egg retention, they can't lay the eggs, anxiety, self-mutilation, gout. Usually self-mutilation and gout go hand in hand. Their legs or their feet hurt so much they basically tear their fingers off, and that's due to the pain caused by the gout. So here you can see several of the veterinarians that have provided cases for these statistics. We're working on an article, but you're seeing a preview of what we're working with. So we have all of them. Sorry if I don't read them all, but their names are here. Their patients have contributed to these statistics. So we started with these avians in zoo, and then we started treating with Dr. Regina Pineda, who was a student back then, but now she's got her title, and the head veterinarian at the Amazonia Vet Clinic, which is Dr. Veronica Diaz. With our earliest pet bird cases, we had Cirillo, who was is an Amazona oratrix. He had these recurrent lesions of feet. Their pet parents did not want to do any studies. We suspected some sort of hepatic problem because he had difficulties healing, creating a scar over the lesion. So he was treated with oral CBD and topical CBD on his feet, and you can see there was an improvement. He was discharged back home, but the problem reincided because the pet parent was not dosing the CBD as recommended. This is Piña. She's a budgie, a Melositacus undulatus. Feather plucking, you can see how she was feather plucking bad enough to also hurt herself, a wound, self-mutilation, and she became really anxious around her pet parent, who was also very anxious, so we also referred him to a CBD physician for humans. And you can see the red thing is not blood. I will show it further down other slides. It's a topical cream we have with CBD, and it also has iron sulfate, I think would be the translation. I'll check that for you. So that gives it a red tinge that looks like dried blood, but it's not blood. And here is Piña after her treatment, and you can see she also has what we call a babero. Basically, you cloth a piece of cloth around her, like what do you call the cone of shame for dogs? But this is made out of fabric, so she can't pluck herself because the fabric is between her beak and her feathers. Then we have Tito. He has gout and has self-mutilated due to pain. Oh, that appeared too fast. But this is Tito, and this is a close-up of his feet. You can see how he's missing a few toes and how inflamed his little feet are. So this is his right foot, this is his left foot, and again, this is his right foot, his left foot. You can see how the skin is much less inflamed here. It's no longer so bloated, so red, so tense looking. It's paler, it's thinner, and he got better. When these patients are chronic, they also have to take CBD chronically because it's not a problem that will be solved. When it's something acute like anxiety, we can wean them off the CBD after the anxious period has passed, but we have to remain vigilant so that they do not reincide. And here is a case with the cream I was telling you about. This is a case with Dr. Adriana Marquez. This is a cockatiel, about 1 year old, who was attacked by a dog. The dog basically chewed on her and she got her right rear limb chewed off. And we can see the lesion here. She clearly still has some of the detritus from her enclosure, some of her feed or food. On the attack, well, she was attacked on December 3, and then she had a surgical amputation, the creation of a stump, removal of the exposed bone up to the joint, and this surgery was performed at the veterinary hospital dedicated to avians in the veterinary school of the National University of Mexico. Her post-surgical pain control, I don't have all the details, but we know she was also treated with asexamic acid, which is the brand Recoveron C, and phenoxyethanol with triticum bulgari, which this is, I think it's wheat. Another thing called phytostimulina, that's a brand name, and these were applied topically to try to stimulate the regeneration of the skin over the stump. However, 2 weeks passed, the red here is when the surgery happened and the accident. 2 weeks had passed and she was not healing properly. No progress was being made. You can see the lesion here. You can see how it's still open and not properly healing over. So 2 weeks happened about December 17. They requested a consultation with us. We made this is the cream, and you can see how it's very dark red. So that's why the feathers look this way here, because they've been tinged with the cream. So she started her CBD treatment with the cream on the 21st of December, and by December 23, 24, we could already start seeing re-epithelialization of the wound. So you can see how it's not inflamed in a bad way, but we can see more color. This means there are more blood vessels working here. And so that this is the advance with 3 days treatment. And then we can see after 12 days of treatment how the wound has completely healed. The skin has completely regenerated. So in less than 2 weeks with the treatment, she clearly got much better. So we are recommending the use of this topical cream for all of these patients that have severe wounds where we need the skin to grow back to cover these injuries. So now we will talk briefly about, my goodness, I'm going really slow. Sorry about that. And I might run 2 hours. I hope not. Um, so this is Macarena. She's a ferret. The case is by Dr. Mary Wong. It was her first case at Pet Exotica. This patient had neuropathic pain. She had fallen from a fifth, sixth, or seventh story. The tutors couldn't get their story straight. She had severe spinal trauma. compression between L5 and L6, and a neurogenic bladder. Her reflexes, she had lost all quadriceps response. Her tibial, cranial, gastrocnemius, and perineal were decreased. We're talking about the rear end of the animal. And her sensory responses were also decreased in the rear limbs. No damage to other nerves nor cranial nerves. She was self mutilating due to pain. So, whenever she was not on opioids, basically meloxicam, fentanyl, or tramadol, she would chew her legs all the way to exposing the bone. So she was sent home with opioids, meloxicam, not anything stronger. And then, unfortunately, their pet parents crushed her with a door and fractured several metatarsals in both of her legs. They took her back to the hospital. The doctor said she would probably need an amputation, and they said, "We can't pay for this. We're clearly not taking care enough, good care of her." So they surrendered her to the hospital, and Dr. Mari Carmen adopted her as her own. That's when she does the first amputation because the tarsals were exposed and honestly not worth doing all the surgery to recover that. And that's when she had her treated with fentanyl. When she was treated with fentanyl, the self mutilation stopped. But it was again a long treatment, so authorities started questioning her fentanyl use because you know how we are about opioids with the opioid epidemic. So she had to switch to tramadol, a very high dose, which is 10 milligrams per kg. She consulted with us in 2021, I think, as well, and we were able to start her on CBD isolate. Oh, there we go. March 2021, she started with CBD isolate at a dose of 0.20, 0.17 mg per kg. We saw some improvements. She decreased her self mutilation, so we increased the dose to 0.33, 0.33 milligrams twice a day. And at this dose, the self mutilation decreased, I mean, disappeared completely. We were able to wean her off of the tramadol and substitute it with CBD isolate 0.33 mg per kg. We had this case published in April of this year as a poster in LabRoots something something. We can also share the poster with you upon request. And she was taken CBD for over 2 years before she had an increase. We increased her to 0.66 because she started getting old, she started moving slower, she started decreasing appetite, all signs of growing older, so that those increased help her. And she was cancer free for all of her life. She lived over 9 years and she passed away, if I'm not mistaken, about 2 years ago. But she was in good health and just passed away due to old age. She had periodical um, blood and urine tests, and everything was normal, so she was doing okay. And here you can see and how she didn't have one of the legs already. She had her other leg, and you can see the bone exposed here and exposed here. So that's why both of her legs were amputated. But guess what? Amputating the legs did not stop the self-mutilation. Even without legs, she started mutilating her abdomen, her lower abdomen around her pelvis, and her tail. So that's why she needed to continue on analgesic treatment. We were able again to substitute opioids with CBD isolate, something that we were told would never happen because CBD wasn't analgesic enough. In this case, where there's clearly neuropathic pain, it worked, and you can see her taking her CBD. Yes, I know I told you no CBD directly from the dropper, but Dr. Wong, she has two droppers, so she backfills one of the droppers with the clean dropper and then gives her the one she can lick. And you can see her with no legs being happy and squiggly and moving all around. She again was in good health, and if CBD treatment was suspended, the self-mutilation restarted. So again, a patient that's chronic and will need to, well, did need to take CBD for the rest of her life. Other exotic animal species, we have Coda, who is this other ferret. She had seasonal influenza and also received a low dose of CBD together with antibiotics, and she did okay. We had, well, all of these I say we because I was doing the counseling for the CBD side, but all of these cases are Dr. Mary Wong's. This hedgehog had wobbly syndrome, and the image covered it here. Sorry, let me move. And he also had a sarcoma. You can see here this, well, you can see the sarcoma here. It was localized here in the purple side, and you can see its incision here. And here's the patient during recovery. We can see the incision here. He also underwent chemotherapy and CBD at a dose of first 0.25, then zero point 0.5 mg per kg twice a day helped her control appetite because she had decreased appetite due to the chemo. CBD helped resolve that. It decreased inflammation, improved mood, and helped the patient. And she also had wobbly syndrome. Dr. Mary has also had other patients, and they also respond well to CBD treatment. Again, these are not directly my patients, so hopefully we can get Dr. Wong. She doesn't speak English, unfortunately, but we might be able to get her to give a presentation, especially on her patients for us if people are interested. So let's talk a little bit about nebulizations. We started nebulizing. Our very first nebulization patient was a dog with several problems in nasal cavity and respiratory system, upper and lower. But we also started nebulizing rabbits with respiratory pasteurellosis. Some of them were receiving only the nebulize, and some of them were receiving oral and nebulizations. We've also nebulized reptiles, including turtles, iguana, and a chameleon, and we will talk about them in the next slide. Here I want to show you one of Dr. Mary Wong's patients, a guinea pig. I know it looks just like a hair or like wig, but it's a long-haired guinea pig here, and you can see the nebulizer receptacle or thingy with the 5 milliliter saline solution go here, and the tubing goes out, and the motor is somewhere else. So let's talk about reptiles and nebulizations with our body and drug compounding. We make formulas again in any concentration, but we've seen that most things that work for our patients are for smaller patients 5 milligrams per milliliter, and for bigger patients, I'm talking dogs and bigger, 10 kilograms or more, 25 mg per milliliter. It's an alcohol base. Yes, we know it's an irritant, but we are using 1, 2, or at most 3 drops per 5 milliliters saline solution. So we're going 0.2 mg up to 0.6 mg total CBD isolate in saline solution. We are not able to know how much of it the patient will actually breathe. We have the advantage that in nebulizations, inhaling the CBD will skip uh, liver first pass, so it will go directly into the bloodstream and give its effect. It will be a shorter effect, but it will happen faster. So it's ideal for reptiles because when reptiles are having problems like inadequate shedding, and these two lost their limbs because they weren't able to shed their skins, they are not eating, they're feeling sick. So when they're not eating, it's difficult to handle them and force oral routes on them. It's easier just to put them in a metabolic cage or a little plastic cage, nebulize them there, and they will inhale. Their metabolism is slower, but they will still get in this way, and what we've seen is they feel better, they start eating again, they get more active, and they recover quicker when we're treating them with nebulizations. We normally recommend to nebulize for 5 minutes and evaluate the effects before deciding to nebulize them for more minutes. And we always have to be monitoring the patient so as to not give a too high a dose. There is no research. We've tried to do a clinical case with one of the universities. Unfortunately, the students went on strike when we were about to do the study, so we were unable to do this. We were going to do this on rabbits nebulizations. So we don't know how much of it is actually going in there, but oral bioavailability is about, well, it's reported mostly in humans to be between 15 and 40%. Again, this will vary by species and by many other situations, but inhaled will be much more bioavailable, so there's no need to go, because I've honestly seen people go with the full dropper and drop the full dropper into the 5 milliliter saline solution, and then they go, why is it bubbling? Why did it become turbid? Why is it no longer clear? Because the indication is 1, 2, or 3 drops max per 5 milliliter saline solution, no more, because it contains alcohol. We don't want that alcohol going too much into their system. Again, do not nebulize oils, only adequate formulas. We do not have hydrosoluble formulas like water soluble formulas here in Mexico, because it's not really a water solubility, it's micronizing the molecules so they get suspended in water. We don't have this technology yet in Mexico, and our authorities do not allow for the import of finished product that has already been treated. So we're still working with alcohol based, but no adverse effect thus far. So let's talk about nebulizations in rabbits. These are Bananin and Bananon, two rabbits from the same pet parent. They were 8-month olds. They were 8 months old, and they were hospitalized with pasteurellosis. It was MDR, so multiple antibiotic resistances. And I didn't know this because I did not specialize in rabbits, but when rabbits get pasteurellosis, it usually means they're going to die. And when it's multi-resistant, it's even worse, but because there's not much we can do. Fortunately for us, we've had great results using nebulizations together with the antibiotic they're most sensitive to. And these two patients, Bananin and Bananon, were receiving first, before incorporating CBD, they were receiving gentamicin intramuscularly once a day for 14 days and acetylcysteine nebulizations once a day, also for 2 weeks. Not enough progress was seen about day 10, 11. So Dr. Wong, who was already working with CBD with us, with her other patients, she added CBD nebulizations twice a day. The first week they were together with gentamicin. Then gentamicin was suspended and continued CBD twice a day for another week. Then CBD only once a day for another week. By then, they were already discharged and gone home. I will mention that these two bunnies that we're seeing in the images are not Bananin and Bananon. I will show them, well, one of them to you in a minute. But this is how we can nebulize our patients. This is the same plastic box that I've shown you in other patients, and it's covered by a towel. It doesn't have to be the plastic lid. It can be a thick piece of fabric. And here you can see the tubing, and the nebulizer is likely inside of the box with him. And this will allow for them to nebulize at home without buying a lot of expensive equipment. The other option, if the patient allows to be held and breathe in the nebulizer directly, you could do this, and this is an ideal route if the patient allows it. And then, oh, well, there it appeared. I will explain it in a second. And this is, I forget which one of them. It's either Bananin or Bananon in Dr. Wong's pet exotical metabolic chamber. And here's the nebulizer. So they're inside nebulizating. They started at 0.15 milligrams total of CBD isolate, but then they went up to 0.3, so 2 drops in 5 milliliter saline solution, inhaled for 2 minutes twice a day. So 2 minutes, not even the 5 minutes we recommended initially. She saw that they were significantly getting better. So basically, when she started with 5 minutes, the patients were a little bit lethargic after the nebulization. So she shortened it to 2 minutes, and she saw that it was ideal for them. So again, it depends on the patient. These are other bunny patients, well, rabbit patients that Dr. Mary has treated. One of them was called, or is called, Mini Waffle, 5-year-olds with malocclusion, pododermatitis, and respiratory infection. He had a surgical correction with analgesia in hospital, then he was sent home with inhaled and oral CBD. The nebulizations were 0.5 milligrams in 5 milliliter saline, so 3 drops, a little bit over 3 drops. They were measuring it in milliliters. And the oral CBD was 0.25 mg per kg twice a day as well. And he went he went home and did well at home. This little mouth here is Mini Waffle, the picture. Then we have Neja, because coneja. female rabbit, 9-year-old with pneumonia and pododermatitis. She was treated in hospital and then went home with CBD nebulizations, zero point 0.3 milligrams total in 5 milliliters saline twice a day. Then Polar had pasteurellosis, pododermatitis, and malocclusion, also surgical solution to the last one. Bonbon also had pasteurellosis, and these two received CBD nebulizations, one drop, so 0.15 milligrams in 5 milliliters saline twice a day, and the antibiotic for these was marbofloxacin. Both of them recovered well and went back home free of Pasteurella. So this looks very promising. So if anyone's interested in rabbit studies, please contact us because we're really trying to get this information out there. All patients recovered and were cleared of infections when adding CBD to the antibiotic treatment. Why? Because CBD works synergistically with antibiotics. So I've had a lot of people tell me, why are we doing it in rabbits? There was an article back in 2024 saying they get inflamed digestive systems and could be a side effect from giving them CBD. Why would we be giving CBD if they're going to get inflamed? The patients weighed an average of 1.6 kilogram and were giving 10 milligrams a day for 27 days. And here you can see in red some of the things I was telling you. Some changes were detected in gastrointestinal tract of the animals. CBD seemed to interfere with protein digestion with significantly lower activity of enzymes, blah, 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 small intestines, increase of fermentative activity of cecal microbiota. This result is important for intestinal health. Fermentation activity modification changed also the abundance of goblet cells in the colon. Our findings suggest that a relatively long-term administration, honestly, to me, a 1 month administration is not long-term because we've done a few months or years with some patients, but may affect digestion in rabbits, particularly enzymatic and fermentative levels. While this may be true, this was a preprint when I requested the full article from the corresponding author, they gave me a different article that was the finished published version that did not include these findings. They had a bigger N and did not have this. But guess what? With the information they published, they were dosing the rabbits over 6 mg per kg per day. So what if this inflammation that we're seeing is a side effect? Look at the range of dosages we are. Over 6 mg per kg, we're in high dosages for these patients. Clinical doses are much lower. Look at the purple ranges. We are using under 1 mg per kg for our clinical patients in rabbits. We are not seeing these side effects. So, well, when we're doing oral, when we're doing inhaled, we have no idea how much it would be. But if we took the 0.5 milligrams total and divided by the patient's weight, we wouldn't be reaching these dosages. Again, we don't have information on how much it's actually inhaled, so it's very important, whether it's oral or inhaled, to start low, go slow, and stay low using the minimal effective dose. There's this article in Rabbits published in August 2022 where they gave CBD, nano-treated CBD, and a control group only with olive oil. It's a thesis for a master's degree, and they were dosed 0.06 mg per kg, a much more reasonable dose in my opinion. They did find that nano-treated CBD yielded a greater average daily weight gain in the kids, not a significant change in the mothers. They have a particular name that I keep forgetting. DAMP. Um, so no adverse effect documented, and nano-treated CBD may positively influence rabbit growth prior to weaning. And again, you can see the gray arrow here is the dose they used, and the purple bracket is the one, the dosage ranges we use. When I requested the article from the last slide with Dr. Nadia Musco, they had used about 12 or 16 rabbits in that study. This one published in August 2025, which is the one the author sent me when I requested the other one, had a higher end. They were about 60 rabbits in this study using the same doses and same durations. However, they did not mention anything about the intestinal problems in this article. And there are additional authors in this article, which makes me think they started their article with a smaller n and then increased the n and didn't see these changes in all of the population. They did find improved meat yield, increased spleen and liver weight percentages, but there weren't adverse effects. They increased liver was probably due to additional metabolization, and the increased spleen was probably due to increased immunomodulating effects. The rabbits had increased activity, including grooming, exploration, and other things, and decreased stress. So again, we're seeing good things even at their higher dose of 6.25 average mg per kg. So let's talk now a little bit about other rodents like squirrels and guinea pigs. We do have the guinea pig that I showed you from the nebulizations earlier. Here we have, their name was Nusita, and she had a recurrent respiratory infection additional to malocclusion. Malocclusion was surgically addressed, and she was nebulized with CBD at zero point 0.3 mg in 5 milliliter saline solution twice a day, additionally with antibiotic, even though I don't have the name of the antibiotic, and they recovered and went home without any problems. We also have this squirrel with a spinal compression due to a fall or some other sort of trauma. The pet parent again didn't or couldn't specify, and you can see how she's not really walking properly. She's not moving a lot right now, but you can see how she's kind of scooting with her back legs rather than walking normally. This is due to their spinal compression, and she started CBD isolate. She started at a very low dose, but got good results at zero point 0.5 mg per kg, which meant we increased the concentration, so she received a lower volume. Unfortunately, the pet parent said, hey, this thing is it's working, but it's really expensive because a bottle for a squirrel is about 600 pesos, which in US dollars would be about $20, which is not a lot. But hey, why should I pay $20 if I can buy something off the internet or at the mall for $5? Which is what the pet parent did. So they bought an unregulated product, gave it to the squirrel, and intoxicated the squirrel because the concentration was too high and because the product probably contained THC. So she came back to an emergency consultation because they had given her an unregulated product and she was presenting neurological signs. When she went back to the CBD isolate in pharma grade medication, the the signs went away again and she recovered fully. This other squirrel is a very recent case. She is not a pet. Well, we're guessing it's a she. She's kind of young yet, but my mother has decided it's a she. So I'll refer to her as a female. And she was doing okay up until one day when my mother saw that she was walking weirdly. You can see here, it's not very noticeable, but you see some videos in the next slide. She's laying pretty much flat on the ground and her tail's not raised. Here is, this was early October, like October 10 or 12, and this is yesterday. It's the same animal, and you can see the significant changes. I will play all the videos in, I don't want to play them all at the same time, but I will try to play them kind of in a sequence, not to take too long in this slide, because I've already ran too long. You can see here how she's laying flat on the ground. She is eating, but her tail is not raised, and you will see that she again kind of scoots. It's a different patient from the previous video, but she's not walking properly. The dates are up here, as you can see. She received her first CBD dose on October 12, and you can see already some improvement in October 13. This is a piece of banana, and my mom put the CBD oil on there. Again, it is not a pet, it's a wildlife squirrel. She lives outside, but my mother feeds a lot of the animals in the place where she lives, and you can see her rear legs aren't quite working properly. By day 3 of treatment, her tail is moving a little bit more. She is moving a little bit more fluently. She wasn't really moving in the very first two videos. You can see her moving a little bit more here, but she's still kind of scooting with her real legs. She was dosed for all of these days, and for a few days afterwards, she was giving 1.5 milligrams total per squirrel because we weren't able, this was a CBD formula for cats. And here you can see her tail is already up. She's a little bit more curvy in her spine and moving a little bit better. And this is about a week later from this video. You can see again she's moving better, and here she's even more fluid. She's doing a little bit better. This is with about a week CBD treatment, and then she started feeling better. So she started missing some of the meal times with my mother, so she went to intermittent. But my mom reported to me really just earlier today that she saw her again and she's moving okay. She still kind of drags one of her legs, the rear left one, but not significantly. So we do not know what happened to her, but she did get improvement with the CBD. This is a chinchilla called Romina. She's a cross between two chinchilla species. And here you can see, I think this was an MRI of her molars. You can, well, premolars, and you can see how both of them are super big, growing with malocclusion, which received surgical treatment. This is a 3D reenactment is not the correct word, but I hope you understand, of her first premolar on one side and molar 1 and molar 2 on the other side, and you can see how far out they are and how much they're injuring the face of this patient. She started at 0.25, but her treatment went on forever because after the surgical treatment, you can see here the protrusions in her molars, and they had already perforated. One of the perforations got infected, it became abscessed, and poor animal had about 3 or 4, no, like 3 months treatment. It started, if I'm not mistaken, in December, yeah, mid-December. Here's this, her entire prescriptions and treatments. This is a case of the pet of Dr. Carlos Flores, well, soon to be doctor, and he started with a very low dose of 0.25, but then increased up to 1.5 mg per kg. These are all their other medications. The ones in color are the ones he's giving constantly, and you can see the gradual increases in CBD. Here you can see what happened with the abscess. It really inflamed. It really affected the cheek and started to affect the eye. So that's where when they added serratiopeptidase to start helping the healing of the wound. Here you can see some of these were videos, but then again, I think it's better idea to invite the Dr. Carlos at some other point so he can explain the full case because he's really got it well documented. And here you can see she was taking about 0.16 milliliters, which started being kind of too oily for a small chinchilla. So we went with a higher concentration and decreased her again to 0.04 milliliters. This is again through drug compounding. We make further concentrations. And you can see how she continued progressing through January up to February, and the ongoing treatments were heat therapy and CBD. All of the other medications were intermittent or depended on several things. She recovered well. It took her a while and she required higher increases. That's one of our highest dose patients, 1.1 mg per kg CBD. And this is a table of published work in other species. This was researched by Dr. Florotis. And you can see several other publications that mention use of cannabis product in several other species, like a python, a tiger, an ibex, lion, mountain lion, opossum. So yes, we have a marsupial here in Mexico, and apparently, well, this wasn't in Mexico, it was in Colombia, but it was treated with CBD and THC. The elephant, and this was not our elephant, this was a 2020 case reported. There was a dolphin. There was also spider monkey, military macaw. Oh, well, this is ours. Never mind. Well, you heard about this. Jaguar, an African hyena, spectacled bear, river otter, and squirrel monkeys. All of these with Drago betancourt are several cases discussed in congresses in the Red Cannabis Medicinal Veterinaria, VetCan group. And the other ones are publications. So there are other species reported, usually not presented as full clinical cases, which is what we're trying to do, but the information is there. And now to start closing up, sorry that I did take pretty much the 2 hours. Marsupials, of course, Australia, New Zealand, and all the adjacent islands have a lot of marsupials that are non-existent in other parts of the world. So here I keep telling my mom she's a Disney princess because again she goes out and feeds animals. Opossums are usually nocturnal and they're definitely not usually seen around people. But here you can see an opossum in broad daylight together with my mom waiting for some food, together with one of the outdoor cats my mom feeds. And they're 2 meters apart. The opossum is not entirely happy that the cat is there, but he's waiting for some of the food and he's out there. So if ever they got injured or needed help, my mom will gladly give CBD to them. Unfortunately, we haven't had any of these cases. So in theory, and as you can see, Dr. Betancourt and Dr. Diana Buitrago have treated an opossum in Colombia. We haven't treated any in Mexico, but I will soon originating from this lecture, I will soon contact one of the associations that rehabilitates these kinds of animals, both cacomixles, I don't know the name in English, and opossums in the reserves near the National University. There's a lot of natural reserves there, and they rehabilitate these animals. So I will get in touch with them, see if they have any cases that might require CBD, and I will let you know when I have a few cases to see if they have a different metabolism of CBD than eutherians, which would be all the other mammals that are not marsupials. So there are very few studies on metabolism, xenobiotic metabolism in marsupials. Most of them are paywalled, so I wasn't able to review them fully, but from the abstracts and information available outside the paywall, I was basically able to gather that their cytochrome P450 works harder because they ingest all of these toxins, mostly happening with these herbivores that eat eucalyptus, so koalas and the something something bush something. Sorry, I forgot their names. They have funny names. Um, I didn't write it down, but it was like the bush possum something. These guys eat eucalyptus, and eucalyptus is very high in some terpenes. Terpenes are created by the plants to protect the plants from insects, from plagues, and from being eaten, and clearly didn't work with eucalyptus with these two main marsupials. And the terpenes that they mostly produce are the ones that you see here: cineol, cymene, limonene, and pinene, alpha-pinene. So what they do is that their livers work much harder to metabolize these terpenes to non-toxic molecules. So in theory, well, what they did see in one of these studies is that the cytochrome enzymes increase the higher the terpenes are in the diet. They did a group with low terpene consumption, a group with high terpene consumption, and their cytochrome enzymes were different. So basically, what we would be thinking is that these patients are metabolizing terpenes differently. I don't know what it. Video played again. Sorry. These animals are metabolizing very differently from eutherians. That it is wrong to try to extrapolate information from species such as rats, dogs, or humans in any kind of drug uses. There's a study with meloxicam that I did have. Oh, wait, that it did appear here. It's the one you're seeing in your screen. And in the case of meloxicam, we shouldn't extrapolate dosages from these patients to marsupials. However, and you can see here in the blue box, that it is theoretically possible to dose them and see good effects from dosing Australasian and Wallaceian marsupials, so the ones in Australia and nearby islands. But it is super, super important to maintain the start low, go slow, stay low, because and I haven't touched this before, we are not looking for plasma concentrations. The endocannabinoid system does not work like regular pharmaceutical active principles. They do not have that straight line in which higher doses will yield higher effects. We already talked about the biphasic effect. So it's very important to understand that if marsupials are going to process, because cannabinoids are part terpenes. They have three parts. I'm not going to get into the biochemistry of cannabinoids right now, but they are a type of terpene. So hypothetically, they would metabolize them faster, which would mean they might process them and get rid of them faster, which in theory could mean that they might need higher doses, they might need more frequent dosing, but again, the endocannabinoid system does not work like other systems. So sometimes just giving it a little nudge, think of it, and I don't like the analogy, apologies for it, but think about it as if a car won't start. That car has lost its homeostasis. If certain cars, you can push them and then turn the engine and they will start, and you don't need to drag them all the way to the mechanic. Same thing with the endocannabinoid system. Sometimes it just needs a little push, and it doesn't necessarily require plasma concentrations. And the way I will end up the part of these clinical cases is mentioning something about cats. There is a published study by Culpa et al. About safety and tolerability of escalating cannabinoid doses in healthy cats. They are the ones that reached up to 30 in CBD and 40 something in THC. And in their conclusions, you see here highlighted in yellow, the maximum plasma concentration of CBD in cats was approximately 1/5 of that plasma concentration that was found in dogs in the same dosage ranges. This suggests larger doses may be needed for therapeutic effects. If I were to do a simple math, I would say, oh, well, if a dog is responding at 1 mg per kg, a cat's going to need 5 mg per kg because of what this article says. However, in our clinical experience, you can see here the comparison. Dogs are purple arrows, cats are blue arrows. Most of our patients, obviously I'm not including all of the patients, but it's our most significant patients, look at the ranges. They're still within, most of them within under 1 milligram per kilogram, the rest of them under 2 milligrams per kilogram. Yes, I have a red arrow here at 2.25 mg per kg in dog and 3.3 mg in cats. These are patients that did not respond to doses. But look at the grouping of the arrows. They are still within the same dosage ranges. Cats also metabolize terpenes differently, so it's hypothesized that they could get intoxicated easily. That's not the case. So please do not apply this linear thinking of, oh, marsupials are going to metabolize it faster or get rid of it faster, so I need to give more, or I need to give it more frequently. It's very important for you to consider that we should always start low, go slow, increase low, and stay at the minimum dose necessary for responses in these patients. So it is theoretically possible to dose them. I'll have to review further the information on the opossum, and of course they're gonna metabolize different. They're in different continents, American marsupials and Australasian marsupials, but it is really possible to do that. And if you're ever interested in getting counseling from or how to dose marsupials, I will more than gladly help. I will end with this slide. Sorry about the time. Research, education, and collaboration. This is what we work for. We really want to share our experiences, get this information out there, show the clinical cases that you're experiencing, show the clinical cases that we're seeing here. I know Australia has similar regulations around drug compounding, so it might be available for veterinary patients. We want research to continue ongoing and not to stay. Something that happens with research in Colombia, for instance, is it gets published in Spanish. So it doesn't reach worldwide audiences, it just stays in Latin America and Spain, basically. So we've contributed to 3 postgraduate dissertations, a few you see here on screen. We have also had several publications in this scientific veterinary magazine that I'm sharing with you, remevet.com. You can see them there in Spanish. And we have published several articles and journals, mostly scientific articles that are not in journals, like the ones you're seeing appearing on screen, the elephant, several clinical cases in dogs, several retrospective studies of what information is available there, and most recently, Macarena's case was published in the 2025 edition. I also have a journal published about the endocannabinoidome. It's more complex than the endocannabinoid system, no time to speak about it today, but it's important that we keep getting this information out there. That's why all of the information that we have as clinical cases, we're trying to get it out there, even if it's only on the internet as a preprint. It's information that we want out there so that if someone else has an elephant that they think might be benefited with CBD, they don't start at 40 mg per kg or 80 mg per kg when we could do 0.05 or 0.03 or 0.07. Again, it depends on each individual patient. So this is all. Thank you for your time. Thank you for your attention. Sorry for running longer than I was expecting, but I really wanted to share all of the details possible with you. If we have time for questions, Dr. Bean will let us know. And if you are not able to ask your question or you need to contact me by any other means, you can scan the QR code to get my WhatsApp, or you can send me an email or text me at the phone number appearing there. 52 is the country code, and the rest of it is my number. So thank you for your time. And if you have any questions, feel free to raise your hand, open your mic, write it in the chat, or whatever means of letting us know your question is. Emma, thank you for your comment. Again, thank you for your time. I'm sorry if I did run long, but it's a lot of information that I want to get out there. And again, if you have any cases, yes, I mostly treat dogs and cats, but we are working with a lot of other species and we want to get this information out there for veterinarians. Sarah, thank you for your comments. Fabulous, very informative. Thank you again. Thank you for your interest and for your time. And well, if there aren't any questions, we can just, well, thank you for your time and close the session.
Yeah, thank you so much, Mish. And thank you everyone for joining. That was really, really comprehensive. So we've got a recording which I can send out to everyone if you want to go through and revise Mish's slides and his contacts and whatnot. So thank you so much, everyone. And if there's no questions, then we'll say good night. Thanks,
Well,
everyone.
thank you, Dr. Beam, for the space, and it was really exciting to be able to present for you. Hopefully, you can review the video, and if you need anything from me, even though we're worlds away, I was telling Anita I am a night owl, so I will gladly get in contact with you in Australian time. And it was a pleasure to be here. Hope you have a lot more interest because we would love to discuss more dosing and more like special clinical cases in the future if you're interested.
Perfect. Okay. Thank you. I'll stop recording and we will say good night.